Beneath the stained glass windows, this church is getting ready for a different Easter crowd. A significant weekend in the Christian calendar, President Donald Trump assured Americans there is light at the end of the tunnel.
We're going to have many Easters together in churches in the future. We're getting closer. You see the numbers. We're getting much closer to getting our country back to the way it was.
As New York's death toll climbed past 6,000, the state's governor moved to reassure residents.
We are flattening the curve. Thank God. Thank God, thank God, thank God. And thank a lot of good people who have been working very hard. That is a moment in time. Don't get complacent. It's what we're doing that's working. Keep doing it. That's the good news. And that good news has a big caveat. We're still in the midst of it.
Governor Cuomo has directed all flags be flown at half-mast in honour of the lives lost. As the sun sets on the state's deadliest day yet, a sense of solidarity reverberates around the city.
And for more, let's bring in journalist Michelle Lamb, who joins us now from New York City. And you know, Michelle, as bad as those numbers are, New York authorities have said the official death toll might actually be an undercount. Why is that?
Well, there's been lots of speculation why the numbers reported are not accurate. And some people are saying that some people just haven't been in the hospital. New York City, Manhattan in particular, there are several people with 2 residents. Their primary is here in Manhattan, and then their secondary homes are in upstate. So I'm assuming when they are making reference to there might be an undercount, there could be people who left the city with COVID-19 and did not know that until they got to their secondary residence, or there were some people who were not fortunate enough to make it to the hospital. We've seen that this virus has impacted so many different people, and there's so many different circumstances. There are some people who live in New York City alone and they don't have family. So each day we're learning more and more about the death toll.
You mentioned that, a lot of people have been going to their second homes outside of the city. There's been a lot of criticism and a bit of blowback regarding that trend. Individuals in those more local communities saying that the people from New York City are bringing coronavirus to them. In that context, how is the healthcare system in New York City and also outside of the city coping right now?
Well, right now, I feel that the city is working closely with the state to pool their resources to basically put together a more effective plan. When we first heard about the first case, the person who worked in the medical care facility, she came in from Iran, and she self-isolated. And then from there, we started seeing numbers growing gradually. In the beginning, most of us here in New York really didn't know what to do. Should we wear a mask? Should we not wear a mask? And at first we were told not to wear masks, then to now wear them to help reduce the numbers. So I think how they've come together in different areas is, you know what, everyone wear a mask as a precautionary measure, and each city is taking the steps to protect their citizens.
Michelle, just briefly before we go, everyone, is under this 2-week stay-at-home order now. How are people coping in what is usually one of the world's busiest cities? I mean, if you look on social media, for example, you have these hashtags which are trending, such as New York Tough. What's the mood?
New York Tough, stay inside. People are just basically reaching out to each other using video chat to just stay in touch and make the social distancing a bit more bearable. I live right by Central Park, and about 7 o'clock each day, everyone goes to the window, we cheer, we clap. And that's in support of, the healthcare professionals who are risking their lives. But also when you look across the way and you see a neighbor that you haven't seen before and you wave and you're like, okay, well, they're here today. It's kind of like a ghost town when you look down a street that's usually heavily populated and there's no one there. So this moment where we're encouraging the healthcare professionals, it's also giving us a glimmer of hope.
Michelle Lam joining us from New York, where there is some evidence at this hour, even despite its deadliest day in the coronavirus, that the curve might be flattening. Thank you so much for joining us for that reporting.
Thank you.
And the death toll in Germany has today passed 2,100, while the number of confirmed infections has risen to more than 108,000. Let's drill down on those figures because they roughly equate to a death rate of 1.9%, which is remarkably low in comparison to other Western nations. The German anomaly has puzzled scientists around the world. Among the answers is the country's abundance of intensive care beds, but the medical system is still stressed, with healthcare workers falling ill and shortages of basic supplies. Now, one hospital in the worst-hit state of Bavaria has granted rare access to the daily war in fighting against COVID-19.
They fight for every life. Doctors and nurses in this clinic in the small Bavarian city of Mühldorf, where makeshift space has become an intensive care unit for some coronavirus patients.
We've now been handling the state of emergency, this massive wave, for 3 weeks. We were prepared, but it's really pushed us to our maximum capacity. We've managed to send some patients home, 5 so far, luckily.
5 Patienten haben wir verlegt, zum Glück.
It's fortunate too that this clinic has 18 ventilators. It's only had to use 12 so far. All of the patients here are in a critical condition.
2 of our 12 patients have now improved, but the other 10 are still on ventilators and they're doing quite badly.
The clinic hasn't been hit so hard by the virus that they'd have to decide who receives ventilator treatment and who doesn't. But there is concern that this is merely the calm before the storm.
It's so stressful and difficult to leave it behind when we go home, but we do our best in this struggle.
It's a struggle that can escalate with shortages of the required equipment. At this facility, nearly everything is in short supply. Some reserves only last 10 days.
Every day we can see shortages of any given item. If we started running low on personal protective equipment, it would mean that infection rates among our staff would rise. But also for other medical devices like syringes. If we don't get enough, we run the risk of needing to use syringes more than once, and we wouldn't meet hygiene standards.
This clinic is treating more than 140 patients, 95 of them suffering from COVID-19. Doctors and nurses are still sometimes powerless before the disease.
The worst moment was when one young patient died. And another one that was personally stressful for me was when a number of our own health workers became infected.
The clinic, in fact, saw 20 doctors and nurses infected with COVID-19. All have been quarantined.
They all got it at the same time, but their colleagues carried on with great composure. We check how they are doing constantly.
The intensive care unit is quickly closed off when new patients are moved in, a lockdown to prevent the spread of the virus. Patients dying is any clinic's worst nightmare. At this facility, 18 people have died of coronavirus to date, and they won't be the last.
Let's bring in political correspondent Hans Brandt from our parliamentary studios here in Berlin. And Hans, as we saw there, clinics are barely coping, yet the death rate is relatively low compared to other countries. Why is that?
Well, one has to say, while the clinics are under strain, they haven't yet reached the peak. They haven't yet exhausted their capacity. In fact, Germany has the largest number of intensive care places per capita in Europe, and that capacity has not been exhausted yet. So even though there are a lot more patients that need ventilation, for instance, at the moment, the capacity for ventilation has not been exhausted. So every patient that needs such intensive care is able still to get it. That means that the number of people that actually die as a result is not as large. And the second factor is the huge amounts of tests that Germany has done, which means that the number of cases, the number of confirmed cases in Germany is very high compared to the number of deaths. For instance, in the United Kingdom, a total number of somewhere over 200,000 tests have been done since the end of January. Here in Germany, 300,000 tests are being done every week. So that means that a lot more people are being discovered who are positive, and the number of deaths compared to that is a lot lower.
Okay, so the higher the amount of people diagnosed, the lower the death rate. Hans, tell us, because, I mean, you know, the general consensus seems to be that Germany has relatively successfully been able to contain the spread of the coronavirus so far. At least they have had some success with that. Does that mean that we could see some relaxation for the lockdowns that are in place?
There's a lot of pressure on the German government for some relaxation to be announced as soon as possible, especially from the business circles. But a survey of German voters recently came to the conclusion that more than half of Germans would agree to an extension of the lockdown measures that are in place at the moment. What's happening is that government ministers, including the health minister, are now starting to talk about the possibility of careful steps of relaxation being taken. At the moment, the lockdown measures are still in place for another 10 days, and the intensive discussions in government will commence sometime next week. I expect that within the next 10 to 20 days, we will see some relaxation in Germany.
Hans Brandt in Berlin, thank you. Now, returning to some of the latest developments in the coronavirus pandemic, the global death toll is approaching 90,000, with more than 1.5 million confirmed infections since the outbreak began. South Korea has reported its smallest one-day increase in new cases since February. Only 39 new infections were registered in the past 24 hours. And in India, officials are sealing off coronavirus hotspots in the capital, New Delhi, and in neighboring states. The number of cases rose to over 5,000 there. Meantime, the number of confirmed coronavirus infections in Germany has risen to more than 108,000, with a death toll of 2,107. And France has been under partial lockdown for over 3 weeks now, but with the number of infections still on the rise, social distancing measures are likely to be extended. President Emmanuel Macron is due to address the nation next week to explain the path forward. In Paris, the rules have become even stricter, enforced with fines and even prison time. Our Paris correspondent, Lisa Lewis, shows us just how small life has become.
I've been confined to these 30 square meters for weeks now, but I do have the right to go out once a day for 1 hour. To do that, I need to fill in this form with the date, the exact departure time and the specific reason. For example, I'm allowed out for an urgent medical appointment or if I'm summoned by a judge. But today, I have to buy food. Bakeries like this one have been allowed to stay open despite the lockdown. They are considered essential services. But even here, business has suffered. Our turnover has gone down by 40% and we had to put half of our 12 employees on temporary unemployment. And we don't know for how long this will go on. We put markers on the ground right away. It has taken some people a bit of time, but now most of the French have understood the rules of social distancing. That's quite an achievement for people renowned for their lack of discipline. Paris is normally a bustling city, but not these days. The lockdown in France is stricter than in some other European countries, and yet not all the French are following the rules. In some Parisian suburbs and certain regions, people are just not observing the lockdown. That negates all the effort made by everyone else. That's why we're cracking down on such behavior. We've already given out hundreds of thousands of fines. Breaching the rules costs €135 or €200 for repeat offences. One person was caught infringing the lockdown 10 times in a row and condemned to 3 months in prison. Doctors agree people should comply with the lockdown. They say it's the only way to slow down the spread of the virus. We have run out of available beds in intensive care units and have to make tough choices. People over 75 years are generally no longer taken in at those units. At least that's the case at hospitals here in Paris and in eastern France. We are still not equipped to do massive testing and hand out masks to everybody, so for now the lockdown will have to stay in place. The government has already announced the lockdown is likely to be extended further.
Right, I'd better get myself home then. But before I go back into isolation, there is one thing I can do with my fellow Parisians, even if we have to keep our distance. Join in the evening applause for all the heroes in this crisis, the healthcare personnel, supermarket cashiers, and of course, my local boulanger.
The sounds of appreciation there that we're hearing in so many global cities. Let's take a look now at some business news from around the world. Australia police have seized the black box from a cruise ship which disembarked hundreds of passengers infected with coronavirus in Sydney. The Ruby Princess has been linked to hundreds of COVID-19 cases and more than a dozen deaths. Investigators want to know why the passengers were allowed to leave the ship in March. Saudi Arabia has announced a 2-week ceasefire in the war in Yemen coming into effect today. The move is believed to have been motivated by the global coronavirus outbreak. Houthi forces aligned with Iran have not said that they will observe the ceasefire. And Oxfam is warning the fallout of the coronavirus outbreak could plunge 500 million people into poverty. A report by the charity concludes the economic crisis to come will be worse than the 2008 global financial crash. It expects poverty worldwide to increase for the first time in 30 years. Well, it is Easter this weekend, and it will be one unlike any other, not least in Jerusalem. Pilgrims have visited for thousands of years there, but with nationwide curfews in effect across Israel, large gatherings cannot take place. It means for the first time, one group is making sure that the city's long-held Easter traditions will be making their way into the digital world.
A new Sunday tradition. An improvised altar is assembled on this rooftop overlooking Jerusalem's Old City. Since visitors are no longer able to come to the churches here, the Austrian Hospice, a Catholic guest house, is bringing the service to them virtually.
Now that people can't come anymore to Jerusalem, we bring Jerusalem to the people, into their homes, on their screens and TV. And we want to keep doing that during the Holy Week and Easter.
Sunday Mass on a rooftop, but without a congregation. Because of the pandemic, gatherings are no longer allowed. The service is live-streamed using a mobile phone. 2 floors down in the now closed coffee shop, a young volunteer follows the broadcast.
I think it provides a kind of support. You know that even though you can't be here every Sunday, you can still be a part of it.
Easter in Jerusalem is very different this year. The normally busy Via Dolorosa, the Way of the Cross, is empty. The Church of the Holy Sepulchre has closed its doors. Most Easter services will be live-streamed instead. It's a highly unusual situation, also for the local Palestinian Christians. Residents are under tight restrictions.
This year we will stay at home, unfortunately. Probably talk to family and friends on the internet through the smartphones. We as Jerusalemites have gotten used to receiving so many pilgrims in the last 2 millennia, at least. But this year will be a tough year because we won't see many visitors.
Wherever people celebrate this Easter, Jerusalem's residents say it's important to show solidarity and not to lose faith that better times will come.